Hi, Ed Marks here, and I want to welcome you to our Digital Voices webinar, What Healthcare Can Learn from Telecom. I'm really excited to talk about this topic because I love hearing from other industries about some of the best practices, and that's one thing we've committed to. So in order to continue to move healthcare forward in terms of digital transformation, it's always good every once in a while to check in with some other industries that maybe are a little bit ahead of us, and what can we learn from them and bring to healthcare so we can make the similar type of improvements in our own organization. So thrilled to have you with us today. And this is live. So we go live for two reasons. One, it makes it fun because we never know really what's going to happen with technology snafus and things like that, or people mowing the lawn outside your window or whatever it might be. But number two is we want to engage with you. So it's really about engagement because it can be boring no matter how exciting the topic, how exciting the hosts or guests might be. It can be boring sometimes if you're not directly engaged. So we don't show PowerPoint slides. It's really a conversation and you're invited into it. So you all know how to do this. You can enter in the chat section any questions you have, and we'll try to get to all of them. So please do engage with us. Any topic is fair related to digital, across payer, across provider, across all of health and life sciences, really, and patients as well. So really excited for our guest today. So let me just do some self-disclosure. Jordan Wehe is our guest. He's the marketing communications guru for Jade Communications. What's unique about Jade is that Jade competes with giants. So they compete against Verizon, AT&T, and they do so rather well. So you're going to hear part of that story. How do they beat out giant competition? And it's really all about digital. And so I'm really excited for you to have this conversation. The other thing you should know about Jordan, we are related. So Jordan is my nephew. So he is one of the children, 4 children from one of my sisters. And Jordan and I have therefore known each other for almost 30 years. And we run together. So that's our shtick, Jordan and I, whenever we're together, family reunions, weddings, other types of celebrations, we get together and run. We've been doing that. Jordan, I don't know, were you like a teenager or maybe preteen when we started running?
That sounds about right, yeah.
So we've been running for a long time. We put in significant miles together, and we just chat about life and pray with one another and just have a good time supporting one another. I'm reverse mentored by Jordan. He's a whiz. He's a digital native, so I'm always learning from Jordan. So it's just a great thing. So anyways, let's jump right in and just get going. So Jordan, introduce yourself. I've given kind of this big sort of like high level overview, but go a little bit more specific into who you are and your sort of professional journey.
Sure, yeah, really great question. Thank you for the intro. Thank you for having me. My name is Jordan. I'm related to Ed. We have very similar blazer styles. I actually wanted to be like all of you. I wanted to work in healthcare, and I have a degree in biochemistry. I was in this fancy program at the University of Colorado, which took 18-year-olds, and it was a combined BA MD program. So I was part of that for about 4 or 5 years, realized healthcare wasn't for me, but I learned a ton about how to approach problems scientifically, methodically, analytically, and then apply that to business. My family owns a small business. It's actually Jade. And I went, got my master's in marketing, came back, and now have applied those same science principles to what we do.
Yeah, and I remember, Jordan, too, that you were a teenager, I think maybe early high school, and you came and you interned with me when I was at Texas Health Resources. I'll never forget, you made such a great impression on the president of our second or third biggest hospital that he gave you his business card. You remember this? And he said,
I do.
As soon as you graduate, you look me up and I'm going to hire you. So you always can come to Texas. And Kurt's still around, and he'll make good on that promise. But that's how impressive you were, even as a teenager, and even more so with what you've done at Jade. So tell us a little bit how you got into communication business, and then a little bit about who you are compared to the giants that you're up against and some of the awards that you won recently.
Sure thing. So I ended up in this business because it's a family business. I never really had any dreams or desires to work in the family business. I always found telecom kind of boring, to be frank. But there became an opportunity about 3 years ago when our business, Jade, tiny little company, competing against Spectrum, Verizon, AT&T, it was a make or break moment. And I got a call from my dad, and he says, Jordan, I need you on the team. I need you to come back. We need to really think about how we're going to differentiate ourselves and offer a better product, better service than some of these other big guys. So I came back, and that was my first task, was how do we differentiate? And the first thing we looked at was digital. How can we make our internet experience, instead of stopping at the front door, which is historically what internet companies used to do, how do we go into the home, provide a service to folks where they can have control over their Wi-Fi, customize their bandwidth, set priority devices, and make it such that there's no other provider that can offer the same thing. So we started on that journey about 1.5 years ago. We've differentiated, and we actually won a huge industry award last year. We were coined the Innovator of the Year out of all internet service providers globally because of our momentum and speed of change with this emphasis on digital. And really, it was about taking a boring industry and turning it into a retail provider. So now we have these layer-on services where people can not only buy internet, but then buy parental controls, buy bandwidth priorities, and make a Wi-Fi ecosystem unique to the home.
Yeah, so here's a couple things that stand out, and I just want to emphasize this to our audience, and as you think about asking questions. So yeah, not everyone in our audience comes from the number 1 or number 2 largest health system in the world or United States. And so they can relate to what you're talking about, Jordan, in terms of you're a smaller company. So I'm a smaller hospital. I may be competing with a giant health system in the same city or maybe in the region. Or now it's for sure with digital, now you're competing, it's slowly
against
happening.
Everybody.
Yeah, against everyone. And then retail. So you really, in order to be successful and viable, you really were forced to innovate, like basically innovate or die.
That's it.
And Jordan, before we go much further, did you already talk about, so you talked about your undergrad and then your DU experience?
I didn't touch much on DU. I did my master's at the University of Denver, and specifically I focused on digital.
Yeah.
So I did my concentration in a digital concentration and then came right out of school to Jade.
Yeah, so I just wanted to emphasize that for the audience a little bit on your higher education background. And not only are you a digital native, but you got your master's in like an MBA program of a very well-known school and focused on digital. So the things that you've done in Jade in just a very short period of time have been quite transformational. So let's talk about telecom in general, the industry in general, and digital transformation over the last couple of years. So you've already shared a little bit. I think we'll go deeper a little bit later on Jade and some of the things that you've done, and we can take over to healthcare. But in general, with telecom, what's been going on in the last couple of years, and how have they been digitally transforming as an industry?
Yeah, good question. I think the first thing we have to recognize is that telecom companies don't compete with other telecoms. We compete with every other company that offers a customer experience. So our competitors are Southwest Airlines, are Tech Mahindra, are Nike, Adidas, because customers have an expectation of how they want to be treated. And if someone treats them better than we do, they already don't like us. No one likes their internet company. You know, we gotta overcompensate and do a lot more. So first is recognizing that your competition is not just those in your industry. We're seeing the same thing that we're seeing in healthcare, where healthcare is retail and so is broadband, so is telecom. Recognizing that is important because, I mean, just announced earlier this week, Amazon Care, right? I'm sure many healthcare organizations are shaking in their boots. Amazon did the same thing to us 5-10 years ago when they monopolized the home and we had to fight for our place in our subscribers' lives. Healthcare institutions are doing the same thing. So recognizing, just to sum it up real quick, recognizing your competition is everybody. 2, recognizing that you have to really own the home. And there's a mass dispersion happening. Healthcare is going to be delivered in the home, just like broadband is. And if you're not there, Amazon will be. And then 3rd is minimizing customer mental energy. There's so much effort when you have to call your internet provider to upgrade, or when you have to call your internet provider to change your Wi-Fi password. how can we make those service elements easier for the subscriber? For us, it was a mobile application. For others, they figured out different ways. But minimizing how much our customers have to think makes our currency, our brand currency, increase.
Yeah, so those are excellent points. So we're talking about digital transformation and telecom, and now sort of transitioning in how we can take some of those best practices over into healthcare. So if I can just summarize really quick, and we'll sort of double click, or as my wine loving friends would say, decant, one of the areas. But yeah, your competition is not necessarily your industry. You're absolutely right. Typically, we would look in our marketplace. What other hospitals are there? What other home care or ambulatory surgery centers are there? But you can't do that anymore. You have to think much broader. There's a lot of new entrants, and Jordan, you took it to a whole nother level now by saying it's the home, and you're actually absolutely right. You have to. I think your phrase was own the home. And that's where healthcare is going to be delivered. And Amazon, as you mentioned, is just very demonstrable evidence of that. But we see it in many other areas, whether it's payers buying up the majority of PCPs, primary care physicians, in the United States, in other areas, Walmart expansion, retail expansion. It's just amazing the amount of different competition coming in from all over. So we have to learn from telecom and other industries that have been disintermediated previously, and make sure that we're seeing those things ahead of time and then taking action so it doesn't happen to our organization. So that's where I want to go then, talking about the double click or decant into minimize customer mental energy. Is that how you said it?
That's how I said it.
So we talk about patient experience. But even the patient experience, we can't limit it to the patient. It's much broader than the patient, especially if you're talking about owning the home. There's more than just the patient in the home. So it's really the whole family. It's a consumer. And so talk a little bit about minimizing customer mental energy. Break it down a little bit further and some examples, whether it's a one touch, like Amazon, one touch to increase your bandwidth or whatever.
That's a great example. It's something we're working on. You must work at Jade. I'm totally kidding. That's something that we're trying to do. Is we make it really hard for people to spend money with us, and so we are working at making our app an in-app purchase type app. So we're making some huge updates to it. So if we know that you have extra folks in the home, we can send a simple push notification to upgrade your internet. If you're having family over once everyone's vaccinated and life gets back to a somewhat normal sense, it'd be easier to adjust your Wi-Fi password, be easier to change or set up a guest network for friends. Even more so right now, what we're seeing is with the advent of digital and these companies getting smarter, is parents requesting parental controls so that their children can limit screen time or limit what they see. If we can make that process easy for them in our mobile app or through talking to a customer on the phone, they value us so much more. Oneclick payments, a great example from Amazon. There are other companies working on that throughout the entire web right now.
Yeah, those are really good examples. It's to make it, if we talk about it in healthcare as the digital front door, and really making the experience as smooth, as easy as possible. One-click billing for healthcare is I have to laugh a little bit because it's so challenge. So like one of the biggest challenges I think we have in healthcare right now is the whole billing process and payment process. But something like that, you would be such an outlier in a positive way from competitors, make it easier. And that's what that's one of the areas that I'm very fearful of for on the healthcare side, traditional payer or provider side, is that a lot of the disintermediation from retail is they're just simplifying payment. You just know up front, and people are doing it, especially millennials who as a large percentage don't really care to have a personal relationship with a primary care physician, much like perhaps my generation and generations before mine have valued. They just want ease. They want to be able to walk in. They want to be able to press a button and have a visit. They just want to know, oh, it's $35 for this visit. Okay, here's $35, and they want to walk out. They don't want to file claims. They don't want to receive an explanation of benefits that they don't understand. So it's a much different type of experience. Are there any other sort of key strategies, Jordan, that you all are doing at Jade in terms of that whole frictionless experience? You gave a couple of good ones already. What about from a service desk point of view? Any changes there?
Yeah, there's some big changes happening. Our office has been closed because of COVID, like every other office in the world. So we're trying to get people to the right person faster. So we've built in some faster protocols to get you into talking with a human. We actually got rid of a majority of our chatbots because we found that people were more frustrated in our market than found them helpful. So we're working with that, but then we're also leveraging our social media for service desk help. Where in the past you might have your social media just be an advertising channel, we use it as a tech support channel. So if people have issues with their internet on Saturday morning, they can chat into our Facebook, and we have an expert technician waiting for them to assist them. They don't have to wait until Monday for help when the CSRs are back in the office or back on the phones.
Yeah, I like that because that resonates with me because that's actually how I interact with Marriott and
Social
American Airlines
media.
specifically. Yes, I've got a back channel away with now. I shouldn't be saying this publicly, but through Twitter, and that's how I get all the action. I had a recent experience. I won't go into the details here because it's not related to our topic, but I had an experience recently, and it was through Twitter that I got the attention of senior management of this particular global organization, and they took immediate action. Had I tried to call their 1-800 number or deal with the chatbot, it would have been a problem for days and days and days and a hassle. But that's really interesting. So again, for our listeners, really practical here, using social media as your service desk. I find that really interesting. Tell us more about the bots, because most of us would be thinking, no, you want to deploy bots because people would rather interact with bots than people, and it's faster and all that kind of stuff. So let me challenge you a little bit on that one. So what happened there, and are you going to retry? Is it just maybe the way that you utilize bots, or is it something more fundamental?
Well, I think that was part of our culture problem is we, being an innovative company, we try to innovate and take on new technologies quickly, sometimes without understanding them fully. And I think that was the case with this chatbot is we got a minimally viable product. We built something kind of from scratch, and it locked customers into the chatbot conversation. They couldn't get out to an actual human. And so it made them so frustrated that we actually had a couple of people quit our service over it because they felt that we were becoming this impersonal, almost global, almost commercial brand. And that's not who we are. So we completely decided to scrap it and start from scratch and designing something new that would let customers get out of that initial conversation to the right person.
Yeah, that's interesting because in some ways, we talk about this a lot. You really always have to be bimodal. You have to offer multiple channels, and it depends on your demographics and who you're serving. So you have to understand your customer, how they want to be interacted with. And that's something we were always very careful of when we were doing sort of like a digital front door at the last health system where I served, is, we weren't going to completely get rid of the kiosks. Some people really like the kiosk. I wanted to go straight to mobile, but we kept the kiosks for a bit, just as a transitionary time. Or some people still like paper, and like we were talking about earlier, there's a certain population that wants to go in and have a face-to-face visit. So so I think in the ideal circumstance, you build modalities and processes for all types of demographics, so that no one is inadvertently discriminated against. Everyone can utilize whatever process works best for them. So you have to have these multi-channels. That's basically what I'm hearing from you.
It is, and purchasing decisions are made on experience and emotion. And so even if they had a good experience, but they're frustrated, it doesn't mean that they're likely to purchase from you again. Or if you're a subscription service like we are, it kind of adds a tick against you, and you have to work to remove that tick.
Yeah, no, that's really good. And the whole focus on, that's been the key to your growth, as you were saying earlier, the whole focus on the customer experience, what we would call patient experience, making it seamless, frictionless, the mental, took down the note, the mental energy that it takes can really be a key differentiator, and it's really worked for all you. So we are live. We're down to 10 minutes. If you have any questions, we have one already on the CARES Act that I want to bring up. But if you have any questions, feel free to enter it into our question box, and we will take that on. So these could be questions related to digital transformation, some of the things that Jordan touched on, what Jade has done to fight off the giants of AT&T and Verizon, how they've done it successfully, what sort of principles and strategies that they're using to really leverage digital to increase the impact of their particular business. But then how do we port that over into healthcare? And I can see, as you can see from the dialogue, it's pretty easy what you can learn from other industries and bring them over. So let's talk a little bit about the CARES Act. Does Jade work with, do you work with any hospitals today? Do you work in healthcare today?
We do. So we actually serve, our service area is about the size of the state of Massachusetts in rural Colorado. So we're southwestern Colorado on the New Mexico border. There are clinics spread out over that entire distance. So not only do we work with major health systems in this area, San Luis Valley Health being the most prominent one, but also some smaller ones serving more rural populations.
Yeah, and so there's been a lot of interest in the CARES Act that was passed. I forget the exact date or within the last year, because there's provisions in there for healthcare.
There is, and I'm really excited about this act, and it's not a perfect act, but I like that the lawmakers acknowledge that broadband is part of the problem. There are 21.3 million Americans without broadband access, and so though there are some funding specific put aside for telehealth and digital health, it's hard when your patients don't have access to the internet. And so we've been working with our hospitals to get their patients access, figuring out creative ways, leveraging the partnership that we have with them to make sure that their health outcomes increase and that we're actually able to provide people with care during COVID-19.
We talk a lot about health equity and those sort of things, and we take it for granted a lot of times that everyone has broadband, everyone has 5G, and it's just not the case. The statistic, Jordan, that you just pointed out, and even this data point is 3 years old, but I think it's probably I don't know that the percentage has shifted that much, but in Cleveland, in the city of Cleveland, so this is not rural area, this is in the city of Cleveland, over 25% of the population did not have access to broadband. I don't know that it's improved much since. I think over time things are getting better, but definitely take advantage of this CARES Act. There's money set aside by Congress for healthcare organizations to improve broadband capabilities, and I think it's about up to $100,000 per healthcare facility that you could spend to enable greater broadband in your particular region.
And pick your broadband provider if you have a choice. Some markets, there's consumerization and you have a choice. Others, it's one provider, kind of like healthcare is, right? One hospital versus 5. Pick your partners wisely. See if they'll go to battle with you. Because if you pick the right one, as you've probably seen already with your technology partners, there is a massive upside to working with someone that wants to work with you and making sure your patients are taken care of.
Yeah, that's a really good point, because again, sometimes it's not the dollars, sometimes it's not the tech, and it's definitely about the experience, and then finding a partner that will work with you and that has shared values and wants to do good, for their people that they serve. So that's a really good point. Look, we're coming down towards the end. I just want to go back one last time, Jordan, in case we missed anything. When we talked about the experience, we talked about simplicity, frictionless, mental energy, one click, what you're trying to incorporate now. You talked about the service desk and the leveraging of social. Is there any other areas that I may have missed that might be portable over to healthcare in terms of, hey, how do we really focus on this patient or consumer experience?
I think it's something that actually you tweeted earlier today. It was using the language of your customers. For us, it's using the language of our subscribers. Many folks who subscribe to internet have no idea what 100 megabits per second is, or a gig. I don't even know if you know what that is,
Yeah.
you know? And so using language that can bring your customers in and make them feel valued and make them feel like they're part of the conversation intellectually, but also in their heart, places you, in terms of the feeling they have for you, much higher than if you talk down to them or use this vernacular, this jargon that can displace people.
Yeah, that's a really important point. You know, my wife, Simran, she's working on her doctorate as a nurse practitioner, and she has to write some research protocols and surveys, and so she takes it through a system where they ascertain, you know, what level is it written at, because you want to be able to communicate at a level that anyone can understand, especially in healthcare and telecom. Telecom, we have very technical jargon, like you mentioned, that not everyone understands, even people in the industry. In healthcare, the vocabulary in healthcare is, I always have to look up words, always myself, trying to figure out what different things are. And so you need to make sure that it's communicated in a way that people understand. And so that is a really important point. So I just want to summarize some of the key points really quick, and that is that you can compete against the giants. So your smaller health system, physician office, you can compete against the giants, whether that's a payer, whether that's retail, big tech, or a bigger hospital, bigger health system. Because the point we're making too, it's no longer regionalized, it's really global because of digital transformation. Remembering that your competition is not necessarily who you would traditionally think about. You got to think much broader than that. You know, consider the new entrants. You got to own the home. That was a really good phrase, Jordan, that you all use. You know, very important to your industry, and I think it's the same for healthcare. And minimize the customer friction or mental energy that it takes. That one-touch experience that we all know about. And then finally, there was much more in this, but these were just some of the highlights. Just the leveraging of social media in a lot of different ways, and speaking at a level that your customers can understand and communicate with. And yeah, those were some of the sort of the higher ones that you mentioned. There was so much in there. I have like 10 or 15 different things.
I have a funny medical one real quick on the
Yeah.
last few minutes. We do some digital marketing services on the side. There was a doctor who was doing rhinoplasties, and his whole website had that word plastered everywhere. Nobody has a clue what a rhinoplasty is. And so when we talked to him, we're like, bro, just put nose job. You know, that's the Google search that is going to return people to your site, because the average consumer has no idea what a rhinoplasty is.
Right. No, that's really good. It's about simplicity. You have to make everything simple. We are in complex industries. We forget that sometimes because we are born in it. And you have to always remember that people aren't in your industry necessarily. So you just need to simplify everything. I know I appreciate when I go outside of healthcare in another industry, hey, just give it to me simple. I don't know what horsepower, I know what horsepower is in a car, but that doesn't mean a lot to me, like a 386 versus a 410. I don't know, but tell me that I can go 0 to 60 in 4 seconds. Okay, I understand that. Yeah, that's simple for me. Okay, Jordan, thanks so much for being our guest. We will post a link. There was a question about a link to the site about the CARES Act. We will post that. Just really quick on some upcoming webinars. So next week, we talk about patient centricity, which is some of the things that Jordan and I touched on today with Dr. John White. He is the CMO of WebMD, was the CMO of Discovery Channel. That's going to be really interesting, and also part of the FDA. And then, of course, we have weekly podcasts, which drop every Wednesday, covers all of healthcare, provider, payer, patients, pharma, the entire industry. Always have really interesting guests like Jordan on there. So please look for that on your favorite streaming platform. So thank you for your time today. Love to chat, and have a super day. Thanks again, Jordan.